We live?
We are live.
Yes, we're live. Paul Wozniak.
And I'm Paul Matthews.
Yes, I'm a broadcaster here for Try 102.5. Thanks a lot for following us. Paul?
I'm the Public Relations Director for Banner Health in our Western Division, mostly up here in Northern Colorado.
Yep, so we're live at McKee Medical Center, right by the McKee Cancer Center. We're going pink for Breast Cancer Awareness Month on our website at try1025.com, on the air, Try 102.5, and doing stuff like this in the community just to help to spread information, you know, and we were talking about this month, Paul, and like what we're going to do with our effort, and it was just like, you know, we just want to share the information that it's important for people to get checked, to take care of themselves, but, you know, if they have a diagnosis, to know the place to go. So, you know, tell us about Banner Health and what you all are offering here in Northern Colorado.
Sure. Well, certainly, the first step is always getting checked. So keeping regular appointments with your primary care physician, making sure that any abnormalities are checked and acted upon quickly when they can be most effectively and easily treated is important. You know, but really at Banner Health, from at every level of the organization, from the housekeeping staff all the way up to our surgeons, to our food service workers, our nurses, and everybody, they're all caregivers. They all work in healthcare because they want to help people.
Yeah.
And that's really what drives them into this business. And at Banner Health, we have a number of things in place that really allow us to really focus on clinical quality, allow us to measure how we're doing, how the outcomes that we're delivering to all of our patients, so that we know in real time, all the time, how well we're doing, and every year we get better and better, and our patients benefit from that.
Nice. Hold it for 1 second. I'm gonna go live real quick here, just with this song intro. We're live on the air as well, so here we go. The best variety for Northern Colorado from the 80s, 90s, and today, broadcasting live from Banner Health and McKee Medical Center and the McKee Cancer Center. It's Paul Wozniak. We're going pink for Breast Cancer Awareness Month, and so glad to be doing so. Thanks to all the folks who have come in for the interviews today. We're going to be helping to spread more information about what you can do to keep yourself happy, healthy, and whole while we play great music for you. Here's Matchbox 20 on Try 102.5. All right, thanks for pausing for that one. We're broadcasting here too. So, we were talking about tracking.
Absolutely.
Tracking makes a big difference.
It does make a big difference, you know, and we see that in a number of different ways. So just last year, Health Grades, one of the largest third-party clinical quality measurement organizations in the country, awarded McKee with one of America's 100 best hospitals. So right here at McKee Medical Center in Loveland, we were named one of America's 100 best hospitals by Health Grades. Nice. And NCMC in Greeley has been named one of America's 50 best hospitals by Health Grades. So this isn't just me, the PR guy, getting on there and saying, "Oh, well, we're fantastic." we have a number of ways that we look at that, and truly Health Grades has seen the same thing.
Yeah. So the work is it's paying off.
It is paying off, absolutely.
Yeah. Arthur Clarke is a great science fiction writer. He said that any sufficiently advanced technology should be indistinguishable from magic. So the new technology comes out and you go, I just can't even wrap my brain around how that works. I'll bet you see some of that in some of the technologies you're able to employ throughout these health systems.
We do. So you know, some of the technologies in terms of really complicated equipment like radiation oncology machines, linear accelerators, and how they deliver radiation in ways that limit damage to surrounding tissue and really just focus solely on the tumor. Those are things I just shake my head and I think, wow, it's amazing that we're able to develop technology like that. But technology isn't always super high tech. Sometimes it's low tech. We have seen studies now where giving a baby a swaddle bath, where you swaddle them up for their very first bath and lay them gently in a sink of water,
yeah,
is far more calming and soothing to a child. And now there's research to back that up, versus when my kids were born and we're holding them under a faucet in a sink and rinsing them off for their first bath. So
yeah,
sometimes it's the low tech innovations that are just as effective, but throughout all levels of the organization, absolutely, healthcare research moves quickly.
What a great idea, though, to think about common sense. It's still just as important, along with the laser guided whatevers that they're using in order to really treat the patients.
It is. It is. You know, one of the things that that Banner Health has done in the last few years that we're really proud of is remote monitoring. So we know that that by having a second set of eyes on every patient, there are distinct clinical benefits. So in every ICU throughout all of Banner Health, including here at McKee, every patient not only is being monitored at the bedside by the nurses and the doctors, but they're being monitored remotely by intensivists and specially trained nurses who sit there in front of a bank of monitors, and they're monitoring every patient's vital signs all the time. So that the second there's even a subtle change in condition, we have algorithms and so on. They're giving them alerts to fire so they can see these things. We can act immediately, and we can improve those outcomes for those patients.
Huh. That's cool to be a part of, isn't it?
It is cool to be a part of, absolutely.
Nice. Great. Well, Paul, we appreciate it. We appreciate the sponsorship very much. We're going pink for Breast Cancer Awareness Month. Banner Health is helping to make it happen, and we're so thankful to be able to be out here to talk to the real people who put it into place. We've already talked with a patient. So thanks for following me on Periscope. We're going to post these on our website and our YouTube page as well. You can find it at try1025.com.